Hello, everybody, and welcome to this new podcast of the American Journal of Public Health. Today, with my co-host, Vickie Mays, associate editor and professor at UCLA, we have decided to have two guests to discuss the impact of politics and voting rights on public health, a very, very important issue, especially this year. And that's why we have our two guests, Tamara Rushovich. She's a doctoral candidate at Harvard School of Public Health. And we published her article about the impact of the Voting Rights Act on infant mortality in the United States. She's followed, the impact, short, medium, and long range. And that's a fabulous article. We're very proud to publish it. And hello, Tamara. Nice to have you with us.
Hello. Thank you for having me.
And then we have Jess Rhodes, who is a professor of political science at the University of Massachusetts in Amherst. And he wrote an editorial to go with Tamara's article. Hello, Jesse. Nice to have you.
It's great to be here. Thanks for the invitation.
Let's go directly into our topic, but I want to make sure that everybody understands the reason why the study was done and the context, because I'm not sure everybody knows what's a Jim Crow law and a Jim Crow states, etc. So I want to ask you, Tamara, why did you do this study?
Sure. So I kind of got to it because my main interest in public health is understanding how societal, structural, institutional factors influence and shape public health and health equity. And I sort of started out being interested in doing work that measures and documents the ways that structural racism and other forms of oppression produce health inequities. And I was inspired by a lot of work being done to measure structural racism, some of the work being done on historical redlining, those kinds of things. And then there was a lot about voter suppression in the news and the disproportionate impact on communities of color and low-income communities. And I started to see some research on voting rights and health, and I was interested in the ways that access to voting and the ability to elect representatives that represent one's own interest and one's communities and how that could impact health. So that kind of led me to have conversations with political scientists and some voting rights activists and others interested in political factors in public health. And then I saw there were studies looking at the impact of the Voting Rights Act of 1965 as kind of this monumental legislation. And there were studies looking at kind of the impacts directly on voter registration and then also on some of the social and economic impacts, which we talk about in public health, the social determinants of health. And so I thought there weren't any studies that actually were directly measuring health impacts. So that's kind of how I came to do this particular study.
That's great. And I really recommend reading your paper because it's really a very interesting article. And indeed, it opens new ways of thinking about the topic. But Jesse, what is this Voting Rights Act? I mean, just can you, the 1965 Voting Rights Act, so that everybody knows?
Sure. So it's really important to place the act in context and to remember that before the Voting Rights Act, that in southern states in particular, states used a combination of legal instruments, economic and social coercion, and extra-legal violence to suppress voting and broader political participation by African Americans. And the federal government, particularly between the mid-1950s and 1965, made various efforts to try to empower African Americans in southern states to vote. And those measures were essentially half measures, and they were largely unsuccessful. And the Voting Rights Act of 1965 was a monumental act because it established really unique and distinctive legal and institutional features to protect voting in new ways. And in particular, institutionalized what's called a pre-clearance regime, in which states or jurisdictions that had histories of low voter turnout and low voter registration, and the way that the formula for identifying those states was created, it was almost exclusively focused on the South, that those jurisdictions, before they could institute changes to their election laws, they had to pre-clear those or get approval from the federal government. Additionally, the Voting Rights Act eliminated some of the traditional barriers to voter registration and voting by African Americans. In particular, it set aside reading and literacy tests, which had been used in a discriminatory fashion in order to prevent African Americans from voting. And it also called on the Attorney General to subject the poll tax to a Supreme Court challenge. And so the act intervened in ways that were historically unprecedented and produced unprecedented results. And that following the act, there was a dramatic increase in voter registration and voting among African Americans in southern states. The act was subsequently extended to protect language minorities, and so swept across the Southwest, as well as other states that had concentrations of voters that did not speak English as a first language, and by consequence, really revolutionized access to registration and voting in the United States.
So what's the poll tax, just to make sure everybody follows?
So the poll tax is literally what it sounds like, that in order to be eligible to register to vote, you had to pay a fee. And although the states did not set very large fees for registration, it's really important to remember that in the Jim Crow South, African Americans were excluded from many middle and high income positions, and they're also denied systematically education that would make them have greater access to affluence. And so these taxes were incredibly onerous in practice and discouraged many people from registering to vote.
And so, Tamara, when you say Jim Crow states, what do you mean, Jim Crow laws?
In this study, we looked, as you're saying, specifically in these Jim Crow states, which refers to states that had laws and policies that legally enforced racial segregation and discrimination. So kind of some of the things that Jesse was mentioning, but like segregated schools or laws prohibiting interracial marriage, some examples. And we, building on actually some of Dr. Krieger's previous work, we used the same way of defining Jim Crow states, which was civil rights activist Pauli Murray has a book called The State's Laws on Race and Color, where it was documented very detailed at the local and state level, all of the states that had enacted these laws. So that's how we kind of define what was a Jim Crow state. It
was a long-term consequence of the way slavery ended in southern states, and they tried to suppress the votes by having all those laws, and finally the Voting Rights Act removed those ability for those states to suppress votes.
I would say, though, and one thing that Tamara and her colleagues point out that's really important is that Jim Crow policies were not limited to the states of the former Confederacy. And so one of the really important things historically for us to remember, but also it's really valuable for their research, is that there are numerous states outside of what we think of as being the South or the former Confederate states that nonetheless enacted policies that systematically discriminated against African Americans on the basis of race.
Such as, can you...
Segregation in education being primary among them. Also, as Tamara mentioned, racial discrimination in marriage relationships. And those are very important features that systematically discriminated against and oppressed African Americans.
And Vickie, do you think we've clarified the context, the background? You want to add something?
No, I actually want to talk about, just so that people understand what Jim Crow is. Jim Crow is actually a character back in the time of when this was going on. It is a blackface minstrel kind of character And so that's where the name Jim Crow comes from. No one knows exactly why they selected that, but what it represents is kind of the, blackface racism that was occurring at that time. So using the term is really, well situated for what was going on then. So, when people hear the term Jim Crow laws, they don't quite know, they're looking for somebody named Jim Crow when it's actually a representation. Representation really matters, and representation continues to kind of cloud and represent, the way in which sometimes we think about things. So for those that don't know Jim Crow, I think that's useful, because you all have talked about the laws, but it's a mimicking. It is a representation that is, incredibly degrading.
And so now that we have the context, we understand, how important this Voting Rights Act was. Tamara, can you tell us about the findings? What was the relationship with infant death, and why did you choose infant death as your outcome?
So just to set up kind of the way we conducted the study to be able to sort of estimate the impact, we compared covered counties versus not covered counties. And as Jessie was explaining, with the Voting Rights Act, they identified particular counties that met a set of requirements, which included previously having things like poll taxes and literacy tests, and also having a very low voter turnout rate. And those counties were subject to then the preclearance, but not all counties in the former Jim Crow states were subject. So we were able to compare the changes in infant death rates in the counties that were covered. So those counties that had particularly egregious voter suppression tactics compared to covered counties that were not covered. And we looked at the change over time in the 5 years before the Voting Rights Act and then in the period after. What we found kind of first in aggregate in both covered and non-covered counties, there was a racial disparity in infant death rates where the rates among Black infant deaths were higher than the white infant death rates, both before and after the passage of the VRA, the Voting Rights Act. The Voting Rights Act didn't solve the full racial disparity or racial inequities in infant deaths. And then we also saw that for Black infant deaths, they were higher in covered counties than they were in non-covered counties before the Voting Rights Act was passed. But white infant death rates were pretty similar in covered and non-covered. So those kind of in aggregate. And then when we look at the trend before and after the passage of the act, we saw that for Black infant deaths, there was an additional decrease in covered counties of 11.4 deaths per county. That was beyond what we saw in the decrease in the non-covered counties. So this translated to around 6,700 fewer deaths than would have been experienced in the absence of the Voting Rights Act. So there was kind of this additional improvement in the infant death rate. And we didn't see that same statistically significant difference for covered counties among white infant death rates. To answer your question about why we looked specifically at infant deaths, for one, there's very good comprehensive data from death certificates from the National Center for Health Statistics that goes back to the 1959. So we had data before and after the passage of the act. And also, when we think about infant death rate, it's a measure that's commonly used to assess kind of general population health, and it has a pretty short etiologic period. So it's plausible that we could see changes in the time frame that we're looking at, as compared to something like heart disease, which has accumulations over a lifetime. Pregnancy is 9 months, and it's affected by sort of acute things like stressors and healthcare facilities quality. So it's plausible that we could see changes in that time frame.
And Jesse, when the political scientist sees that political changes have health impact, how do you react? Does it sound plausible?
Yeah, so it's very, very exciting, and so Tamara and her colleagues have done really fantastic work here and have really highlighted previously obscured impact of the Voting Rights Act. And I think one thing that is going to be important. And actually, I'm really interested in hearing Tamara and her colleagues' future work and hearing from Tamara about this, about the mechanisms that are producing this really important effect. And so we know something that is a critical distinction between the covered counties and the uncovered counties is that the covered counties were subjected to a much higher degree of scrutiny from the federal government than were non-covered counties. That the entire United States is covered by Section 2 of the Voting Rights Act, which prohibits discrimination and access to the ballot. However, in order to enforce that provision, the federal government or private litigants have to sue in court. Whereas under Sections 4 and 5 of the Act, jurisdictions have an obligation to submit their election laws for pre-approval, and the presumption is that they could be discriminatory, and the jurisdiction has to show that they are not. And so what this means is that those jurisdictions that are covered by Sections 4 and 5 were in a much higher level of scrutiny. This makes it likely that in those jurisdictions, there was a greater pressure for political and institutional change that would incorporate the voices of African American constituents into the political process. And if that's the case, then we could reasonably hypothesize that this gives African American constituents in those counties greater leverage to demand of their elected representatives policy changes that would be associated with improvements in public health. And so I suspect that that is what we were seeing on the ground. I find that very plausible, and I think it's a really interesting and fruitful area for future research.
Very interesting. And I mean, Vickie, we need to have your feedback here, because this is a very key element that we've discussed a lot, having a voice, having, being at the table, contributing to policy, that's what makes the change. So what do you think?
Well, I think that what we're seeing is over time is the beginning of, how the context of laws, not just the context of an individual's, kind of status in society, but what we're beginning to see, and it's great for public health, is this bringing in the context in which people live and what is the implication of that for their lives. And we've done that in terms of looking at the economy, but we haven't done it in the sense of making the federal government a little bit more responsible by beginning to think about every law has consequences. Every bill has potential, but it also can have, for some people a downside and for other people a great upside. So it's a way of starting, which I'm really thrilled about, is like when we start thinking about equity, we start thinking about not just equity in terms of a benefit, but we start thinking about equity in a way in which we say we have to also long-term look at consequences. This fits with what the federal government is starting to do, which is evidence-based approaches to policies. So I think you all are at the prefaces of really helping us begin to think about what is the evidence that we need, and is it that we just do this in the short term, or should every policy have someone come back 5 years later, 10 years later and say, did this really work equitably across everyone? And if not, and you talked about this, Jesse, is as you go along, you need to sometimes fine tune some of these policies and add things. So I think you all are calling on, other scientists and researchers and public health people to say, it's not just in the individual, but, we need to think about in public health what it is that, we want to do. So I really applaud the work and think the next steps could be really exciting. So, part of doing this podcast is to make visible this work and hoping that a lot of people will build on it. So I want to ask a question. Jim Crow may sound like a term that's in the past, but some of us that live in this era know that there are Jim Crow-like experiences that still exist. So if you were to do this today, what do you think you would focus on in terms of, we have an election? We talk about things like primary versus general, and like electing people. Stacey Abrams tells you, oh, pay attention to electing the people where you live, not just the president and others. Tell me what you would like to do today with these findings.
I mean, I think there's so many things in the area of voting rights that one could look at. We didn't talk about the fact that in 2013, the preclearance from the Voting Rights Act was the Supreme Court ruled in Shelby versus Holder to kind of remove that requirement. So that led to a lot of states an increase in restrictive voting policies like restriction to early voting, absentee vote, voter roll purges, a lot of different types of voter restrictions. And so, I mean, one could definitely look at the effects of those. And then I think the also increase in partisan gerrymandering and kind of the effect that that has on who's being elected and whose interests the elected officials are representing, who's benefiting, who's losing. So I think those are a lot of areas that we can think about actually do have to do with public health and can affect public health. And there's been some work, but there could definitely be more.
I agree with Tamara. I would say one thing that is really critical and I think is highlighted in this research because they're looking at county differences and change over time across counties is that, and again, I'm not a public health expert, but with respect to policies that could be affecting public health on the margins, that state and local government policies are really critical. And, I'm thinking of everything from, decisions about zoning that could result in the siting of hospitals and care units to state and local policies that affect at the margins who is receiving education and licensure and experience that will provide for the kinds of care that vulnerable mothers and vulnerable infants need for their health, to nutritional assistance programs for mothers with small children, and so forth. I think a really interesting and critical question is how specific voting policies and policies that affect access to the ballot, policies that affect registration, are downstream influencing the generation or the obstruction of these critical policies. And so what I really love about the work of Tamara and her colleagues is that they're showing this in a very powerful way, identifying a causal effect of these policies. And I think a really important next step and a really critical set of conversations is at the granular level, when we're talking about policies that affect at the margins people's access to the ballot, what is influencing the production or the suppression of policies that affect the health of women and infants.
We're reaching the end of this podcast, and I just want to use the last minutes that we have for you to have final comments and maybe Vickie a final general comment on this discussion. Tamara, you want to start?
Yeah, I would just say that I think more and more to kind of, as Vickie was talking about, to show that it's important in public health to think about what these broader factors at the political level, at the societal level, institutional level, and how those shape people's lived experience, and that we can actually measure and document in a quantitative way these effects, and that to provide this evidence and documentation, which hopefully can then result in beneficial policies to kind of promote equity. And so I hope that that's what the future holds.
Absolutely. And your work contributes a lot to that. Good job. Again, I invite our listener to read your article. And Jesse, what's your final word?
I just want to applaud Tamara and her colleagues for really fantastic work and just say that I think that this is the kind of work that needs to be done. And I'm very excited about research that is crossing the boundaries between public health research and study of politics and institutions. I think there should be more of this work, and I really applaud their efforts to show the practical impact of major institutional changes on the life chances of ordinary people.
Thank you, Jesse. Thank you, and for your very interesting editorial too, that people should read, along with Tamara's article. Thank you for your time. And Vickie,
One of the things I want to leave us with is to really think about this notion of, and Tamara does this, is that history leaves a legacy. And what we're doing is learning how to match data with the legacy. No data is too old sometimes to begin to understand where we're going in the future. So I really applaud you for the creativity, and as you're right, Professor Krieger has been doing some of this. So I want people to think about that history is also insights into prevention. And so I think that's a very important lesson for us to carry forward. And my second point, which is really, kind of a mantle I'm hoping Jesse will carry, which is public health invites political scientists to be with us even more. We're starting to learn in public health that it isn't just about the health itself, but it's about, we live in a context. I always say that we live in a context, and that context differs. And we need political scientists, we need historians to help us to really make the craft of our public health interventions sharper and more effective by being able to learn from you where to focus. Jesse, you're welcome into public health anytime.
Well, thank you very much. It's very generous, and it's very exciting. So I really appreciate it.
Thank you, everybody. Thank you for your time. Thank you for your great work. I think Vickie's summarized also what is the mission of this journal. We want to bring together all this expertise in order to improve the health of the public. And so hope to see you again soon in another podcast. Bye-bye, everybody.
Thank you so much.
Thank you.